be okay?
Yes, doctor.
Okay, thank you. Mrs. Smith, do you know why this meeting has been called upon? What brought you here today?
Thank you, doctor, for asking. Actually, I am a known case of some brain tumor, and the brain surgeon has removed this brain tumor. So I'm coming on regular follow-ups. Today, I came here for my regular follow-up today.
Okay, so Mrs. Smith, I appreciate the knowledge you have regarding your medical health condition. So, what concerns you have regarding your condition?
Doctor, actually, I'm too much worried about that because I suffered a lot because of this GP because he missed my diagnosis. If he would be able to pick up earlier, this my diagnosis, he kept me long time in his clinic, and he was treating some of my headaches and give me some medicine. If he would be able to pick up that diagnosis earlier, I didn't be suffer at all. So I need some your opinion. What do you think? I want to you know write an uh, this complaint against this doctor.
I appreciate the concerns you have and the worries you have regarding your health condition. Mrs. Smith, as you know that your brain tumor has been treated successfully and you are doing well. That is the good part of it. But the concern you have regarding why the diagnosis was late, um, being in this state, I cannot say what was the condition with which you were presented to that GP and why, what perceptions he made regarding your health condition. Are you getting my point?
Doctor, I am getting your point, but it's how long I have suffered because of this GP. Why he was not able to pick up my diagnosis earlier? Why he didn't
Uh,
refer me to your clinic? You know better because you are a brain doctor and you are working over here. So how it was frustrating for me, you don't know even.
Mrs. Smith, I appreciate the concerns you have, but the condition with which you presented to that GP might have different impact on the diagnosis of that GP. And but when you presented to us, so the diagnosis were being made by our brain doctors and other tumor doctors. So major the why the diagnosis was late can only be get to know by having another meeting with those uh, doctors who treated you, our brain doctors and other tumor doctors. Are you getting my point?
Yes, doctor, I'm getting you, but really, I want to launch a complaint against him. I want to punish him. I asked, how many times I requested him, please, doctor, if you don't know what's going on with me, please refer me to the brain doctor. Let him uh, diagnose me and give some treatment possible. But he didn't listen me at all.
I
So
appreciate the concerns you have, Mrs.
I think
Smith.
I need to complain against him.
Okay, I am extremely sorry the worries you are suffering from. Actually, when have presented to that GP, might the condition was so different from the way you presented to our setup, and the better answer can only be given by the doctors who treated the tumor well and who operated it. Are you getting my point?
Yes, doctor, I'm getting you. What do you want to offer me now? What should I do now?
So, I would rather advise you to have another meeting so that our consultants who were involved in your treatment should gather together and to discuss why the condition was diagnosed late.
No, doctor, it's not suits me. I want to launch a complaint against him. I want to write a complaint. I don't need any
Uh,
consultation more because I suffered a lot. I have been operated for his negligence. One should be punished.
so, Mrs. Smith, you have valid worries, but what is the issue is the doctors who treated you can better understand can better understand why the disease was diagnosed late and what were the reason behind the GP's consideration of this
Doctor,
disease
why
as
you are protecting your GP? Why you are protecting? Why you are not giving me paper to refer me to somewhere that I should be able to write some complaint against him? Why you are protecting
I
him? Because you
I
are all same.
I appreciate your concern. No, we are not all same. You were presented to that GP prior to our setup, but you can, if you have issues, you can launch your complaint through an external body which has no link with our setup and to that GP as well. And that body is the PALS body. Do you have any idea about it?
No, doctor, I don't know. I don't trust you guys more. I want to do some investigation by my own now. What they will do
I'm
if you will refer
I'm
me?
so,
What they will do for me?
I'm sorry for your concern. Um, that
2 minutes left.
PALS is a patient advisory license service that is completely an independent body and that has no connection with any of the medical personnel. So you can easily launch your complaint there and they'll help you in this regard. Are you with me?
Doctor, I'm listening to you carefully because I'm suffering, and again, you are referring me to your own department. Of course, you are all same, and of course, they will defend and protect their doctors. They will not listen me. So, rather than to go this pulse, I would prefer to go for the legal action now.
So, Mrs. Smith, I appreciate the concerns you have, and your concerns are valid. But rather going to the legal pathway can compromise you with your financial status as well as with the time you have. And but the pulse body to which I am referring you is an independent body and has no link with us or is any of the medical personnel. So they're going to help you out in this regard with no connections to our body. Are you getting my point?
Yes, doctor, but I don't trust you guys more. I have suffered a lot, and I will take a legal action against you. I will go by my own way, and I will see you guys.
I
I came
appreciate
to
the
you
concern you
to seek a help, and you are going to refer me now. I need your advice, and you are sending me somewhere else, here and there. No, thank you so much, doctor.
Thank you so much.
Thank you. Time up. Yes, Doctor Purat. Well done. You had a tough guy today. Surrogate was a little bit, irritated because of his surgery. So, tell me your performance by yourself, and we will ask from the audience, and then we will discuss about this case in detail. Okay? What do you think?
Yes, sir.
How was your
Most of the
performance?
I have no idea how the performance was because I was unable to calm down the surrogate. But most of the time, I've heard that in uh, centers, when the surrogate is not being calmed by the doctor, they don't take it easily and they deduct the marks. So is it so?
So there were a few mistakes actually. You wasn't able to pick up earlier, so that's why the surrogate was so aggressive till the end. And
Hmm.
what else? Okay,
Sir, you are
anyone?
my mentor. You can better understand and gauge it.
Okay, okay. Anyone else from the audience want to give his input regarding this case?
I think we should sorry apologize to the surrogate on behalf of the GP, and
Okay.
also uh, in the beginning we shall talk about the PAL that we can write an incident report and inquire about it.
Okay. Okay. Dr. Aswand, I will explain your my answer in detail, and you will understand what was the actually this scenario was. And this type of scenarios are coming very frequently, and you need to be very vigilant when you are outside the station. You have a 3 to 5 minutes, and you should know your role, and you should see what the patient is asking and where you are referring this case. Okay,
Okay,
GP
sir.
is not GP is not concerned at all with this neuro department, right? Okay, is there anything else? Anyone else? Anybody else want to give his or her input regarding this case? Okay, let's start with the explanation now. So, patient Mrs. Smith, 57 years old, she was treated because of some brain tumor. She is now on follow-up case. So, how we should proceed this case? Hello, introduction, like always, usual introduction. Hello, my name is Dr. Azhar. I'm one of the doctor today in this clinic. No need to mention any brain clinic or GI clinic or anything. If you want to be a fluent, no need to mention any the name of the clinic. Then, am I talking with the Miss Smith, 57 years age? Yes, doctor. So today we are here to discuss with you about your health condition. Is that okay with you? Okay. So, how much you know so far you about your health condition? That was the question from the doctor. So she explained that very well. I was treated for the brain tumor, and so I am regular on follow-ups. So I'm here today for on my regular follow-up. So here, Dr. Kurat should give some sympathy and empathy and must ask here how you're feeling today about your health. Okay, this was missing during the communication. So, Dr. Kurat, you didn't ask about her health at that time. Coming
Okay, sir,
further,
this was
then
my mistake.
she was aggressive, and the GP missed her diagnosis earlier, and she was treated for the brain tumor at the late stages. And now you can start. Yes, Mrs. Smith, I can understand your worries. So you have been treated for your brain tumor, and the brain doctor and the this nerve doctor also they are evaluated very well, and your treatment has been finished now. You will be on the regular follow-ups. Regarding your issue, this GP missed your diagnosis. Okay, here you need to play very technically and very wisely here. Okay, give some sympathy, empathy. This must be frustrating for you. I understand you're suffering. It is very hard to have such condition. Then now you will not blame anyone about the GP or I am not there. I was not there. I will uh, see your previous record. No, just ask before proceeding further, Mrs. Smith. You please tell me what were the symptoms that time? What were the problems you had at that time? What was the complaints at that time? I was not there. Can you tell me by your own words? So she will give you information from the first visit. I had a headache, then throwing up, tummy pain, or like double vision, difficulty in walking, whatever she is giving you information. You should be an active listener and give sympathy and empathy plus in the chunks, and don't blame any colleague at that time. Listen, listen, listen. When you finish, yes, Mr. Smith, I understand that was a frustrating for you. That was a difficult time for you. But after going through all these sufferings and you have been treated, and I really don't know what to do, but I can arrange a meeting for you with the consultant and the doctor who operated, and they will be in better position to assess what GP did, what he was given at that time to you. Okay, it's not a senior house officer or house officer duty to gauge any negligence or any problem. So if you don't know the answer, Dr. Kurat did very well. So she asked me, so I can arrange a meeting with the seniors. But surrogate again, no, I want to launch a complaint. I want to write a complaint. Dr. Kurat, remember, this was a GP. This was not a, your hospital. So where should you refer this case? PALS or GP surgery? If the complaint in against GP, then you should refer this case to the GP surgery, not a PALS. Right, Dr.
Okay.
Kurat?
Okay, sir.
Okay. So this was your mistake at that time. Need to refer this case to the GP surgery, and they will investigate, and they will investigate thoroughly, and what was happened and what was the system. So give them some trust, empathy, sympathy. So they are working independently. They will work with that, and what for the result will be available. They will inform you in a couple of weeks. Usually they are giving the reports in 20 to 28 days, but don't mention any name, any numbers. Just say couple of weeks. That will on the safe side. Give you reassurance again. I am here with you. I can support you. I am here. I will be. We will take care of you. Okay. Then again, surrogate. I want to take a legal action. Dr. Kural, why you delay that when the patient is asking you, I want to launch a complaint? First, you give the information. You are going to arrange a meeting with the senior. This is the first step. If the patient is insisting again and again, refer him immediately. Don't delay. If you will delay, believe me, examiner will mind this and he will take your marks. Okay. First step, you give a referral. Second step, again, surrogate is asking you why I was asking again, because I want to listen from you that you are going to refer me to the GP surgery. First time, give sympathy, empathy, information. Second time, patient is asking, immediately refer to him. Now he is asking you a legal action. Okay, no need, no problem. If you want to take the legal action, it is your right. You can take a legal action. For this, again, I'm going to refer you to the patient advisory liaison office, and they will guide you regarding this. Full stop. No need to give any more information. Dear students, this type of scenarios are coming very frequently. You need to be very vigilant when you are outside, when you are preparing this card. What is your role? Who is responsible person? Where to refer? And how to protect your colleagues. So there are few points regarding this scenario. Then we will end this meeting. There are few agendas here. I want to add more. The summary of this scenario was why a patient was complaining against GP, because was poor communication between GP and the patient. Okay, so you can resolve this issue very easily with sympathy, empathy, and by your wise decisions at that time. If the patient is angry, please listen him carefully and don't criticize your colleagues. This is the whole, and where to refer. This is very important. Where to refer? GP surgery or PALS. From my side, I have finished this case. Is there any questions regarding this case? We can discuss.
Sir, I have a question.
Yes.
Sir, that it's written there that you are not required to take history. So,
Mhm.
is it okay if I'll be asking regarding that? What were your symptoms and what brought you to the GP? How were you feeling at that moment? Would that be okay?
Yes, that would be okay. Some relevant history you should always take. Sometimes you are taking the history regarding the social history. Okay. Are you smoking? Are you living alone? Who is taking care of you? You're not taking history. In the social history, you're taking the history. So relevant history, in this case, it's very, very important. Don't blame anyone. Just ask the patient what was your symptoms and when, why you were going to the GP, and why he was, how he was treating. Okay, because to cool down her emotions at that time. Are you getting me?
Yes, sir.
Just to cool down. She will explain you. She will tell you. She will be cool, cool, and cool. Just sympathy, empathy. Yes, yes, Mrs. Smith. I can understand that was a very difficult time for you. This must be difficult. You have suffered a lot, but I'm here to help you, support you. We will do everything, whatever you want from us. Okay. Then again, when you, what you think? Should I write a complaint against this GP? I highly appreciate your concern, Mrs. Smith. This wasn't be happen, but actually I was out of scene. I was not there. So what I can do for you, I can arrange a meeting with this brain surgeon and the brain doctor. Okay, they will be better judge about this condition, what GP has missed and why he missed. So this scenario is a very technical. Okay, you need to be very careful. Such kind of scenarios are coming very frequently nowadays. Is there any question from anyone?
Hello.
Yes.
No, sir. No, sir. I have a question that here preferred means complaint to the pulse or the GP surgery.
Actually, the complaint, she's complaining against GP, and GP is not part of your hospital. So for the GP, there is a GP surgery. There is a different departments.
So in this case, if she asks about the GP to complain, then we can say that you can complain to the GP manager at the GP surgery like that.
Yes, you will not complain. You will refer her to the GP surgery. And GP complain. She will go there. They will uh, they will give an idea, and they will explain her how what is the procedure. This is just no, in exams you actually you should not know. You don't even no need to know about what their work, just to refer. you know you should have an idea where to go this patient. Did you get your answer, doctor?
Yes, doctor. Yes, doctor.
So GP responsible, GP surgery. Your hospital responsible, any type of error, misdiagnosis, overdose, misdose, side effects, then pulse. Okay.
Okay. Okay. In this case, then if as the GP is involved, so the GP means surgery. We are going to refer the patient to.
Yes, doctor. Yes, you're right.
Thank, thank you.
You're welcome. Dr. Kurat, you did very well. These are few actually need to mention your mistakes. So I already mentioned, but you did very great job. You remained cool and calm. That was the perfect job, and that was the demand of this scenario. No need to be irritated in front of any examiner or surrogate. They will instigate you, they will stimulate you to, you should be, lose your temperament, but be cool and calm like Dr. Kura today. She did very well. So, Dr. Kurat, do you
Thank
have
you,
any
sir.
questions?
No, sir, you have very well explained this scenario as whole.
Okay, if there is any question, then okay. If there is no question, I'm going to end this
Sir,
meeting. And yes,
sir, if such a medical error or delayed diagnosis occur in another hospital, another institute, still we will refer patient to the GP surgery or the PAL.
no, usually in paces, doctor, thank you for your question. Usually in paces, you need to be very superficial. They are giving you ideas that your hospital missed some diagnosis, either tertiary care hospital, either GP. Okay. If tertiary care hospital, pulse. If GP, GP surgery. Khalas.
Okay, sir, got it. Thank you.
Okay. But remember only one this shortcut. If GP is
Yes.
responsible, GP surgery. If tertiary care hospital, then pulse. If they want to go for the legal action, let them go again, refer to the pulse, and pulse will explain them what is the protocol, what is the procedure for launching a legal action. If you don't know anything about that, Dr. Kurat did very well. So she didn't know about this case. She mentioned that this case should be referred to. I can arrange a meeting with surgeon and brain physician. So that was a very good answer, and examiner will give maximum marks in this case.
Okay.
Okay.
So, Dr. Azhar,
Yes.
yeah, uh, thank you for the really technical, challenging case. This one. So
Yes.
first, if we tell him that we can arrange a meeting with a senior, and the patient is still angry and she wants
Yes.
to launch a complaint, then
Yes.
we have to say that it is your right to launch a complaint. And
Yes.
like after that, what legal, like, should we ask, like, uh, if should we tell her where she has to go, what form she has to fill up, or anything like that? License office or what else? Can you explain that part again, please?
Very good question from Doctor. What's your name, Doctor?
Dr. Said.
Dr. Said, thank you for asking this question. Actually,
Sure.
Doctor, we don't need this is examination of communication. Just they want to judge our not clinical knowledge, not medical knowledge. They are judging only our communication skills. How we are going to cool down this patient and this surrogate. This is our basic
Mhm,
task. In exams,
mhm,
surrogate are handed over their task before the exams, and you are handed over your task before the exam. 5 minutes. Okay.
mhm,
There are few challenges, few concerns are written in surrogate's paper, and you should answer these concerns. And they will not, the surrogate will never repeat that question again if you
mhm.
just refer to the GP surgery.
Okay.
No need
Okay.
to explain in detail because you don't have time there. You see, when you are going to introduce yourself, it takes 2 to 3 minutes. Hello, my name is Doctor. You must be, and why we are here. Agenda, then eyes, you know, then sympathy, empathy. It takes 2 to 3 minutes. Then
Mhm,
you are going
mhm.
to wind up this case again 2 to 3 minutes needed. So you have only window of 4 to 5 minutes to fulfill
Okay.
your task and fulfill
Mhm,
her concerns or his concerns. Surrogate concern, he is have minimum 3 to 4 concerns, and concerns have a
okay.
separate marks. So wind up as soon as early you can. So you can jump another task, other concern. If you refer her, she will not never touch again. She will come to the other concerns. If you remove that concern, address that concern, she will jump to another concern,
Okay. Okay.
because this is a task of surrogate given by the examiners, by RCP. This surrogate is not pretending, not complaining, or no symptoms, no complaint from herself or himself. This task was
Mhm,
given by the RCP, okay,
mhm.
to judge your
Mm.
ability, how you are going to communicate with this scenario and this scene, this situation if it happened to you.
Okay.
Okay, I hope you get your answer.
Yes. Thank you, doctor.
You are welcome. You are welcome. If no question, then I'm going to end this meeting. And thank you so much, all of you, for joining us today. Thank you so much, doctors.
Thank you.
Okay. Assalamu alaikum.
Whatever.